Hello, and welcome to another edition of Health Bites. Now, today I wanted to shine the spotlight on the pervasive use of antacids and offer a safer and ultimately long-lasting solution to the underlying reasons for the prolific use of these drugs. So first of all, though, let's answer the question, just what are antacids? Well, they are one of the most commonly used over-the-counter pharmaceutical drugs, and they're used for symptoms of acid reflux, heartburn, indigestion, and these are often referred to or lumped under medical terms such as dyspepsia or a condition with the acronym GERD. Now, the symptoms that generally prompt the use of antacids are indigestion in various shapes and forms, abdominal pain that goes with that, nausea and or vomiting, belching or burping, heartburn, chest pain, and should this get worse, there may be a stomach ulcer that goes hand in hand with this. Now, and in more rare cases, stomach ulcers may bleed, and this would be evidenced by dark or almost black stools. Okay, so that briefly are the is a list of the symptoms. Now, let's look a little bit closer at these pharmaceutical antacids. There are three main families. Firstly, the family of drugs that neutralize the acid in the stomach. And this is a group of drugs that is usually used in the incidence of occasional heartburn symptoms or after a night out, lots of spicy food, that kind of thing. And the idea of which is to offer quick and occasional relief. The active ingredients that are common in these in this group of drugs is aluminium hydroxide, magnesium hydroxide, and calcium carbonate. And the trade names that you may know and which these drugs are commonly sold under are Pepto-Bismol, milk of magnesia, Acid-Gon, Tums, it depends on the country that you're in. And the side effects that generally go hand in hand with this group of drugs is constipation. This is really quite common with these drugs. And also of note, they often contain aluminium. And as we've alluded to in previous health bites, this is really something you want to avoid. Aluminium is a heavy metal and it is neurotoxic. So check out our other health bites where we go into more detail in that regard. The second family of antacid pharmaceuticals is what we call the H2 receptor antagonists. And this is a group of drugs that tend to be more often recommended for more persistent symptoms, but still nonetheless mild symptoms. And one of the most common in this group is goes under the name of famotidine. It's that's the generic name, but the trade name that you may be familiar with is Zantac or Pepcid. Now, the side effects associated with this family of drugs are headaches, dizziness, again constipation, and or diarrhea. Those are the common side effects. However, this family of drugs also has a very long list of more uncommon side effects. The list is really too long to go into here, but these are side effects you really don't want to experience. So I urge you to do an online search of these side effects if you or someone that you know and love is taking this drug. And then the third group of antacid drugs are referred to as proton pump inhibitors. And these are really reserved mainly for moderate to severe symptoms and really ongoing symptoms of gastric reflux. And the most common generic drug in this group is omeprazole. Okay, and with regards to the trade name that you may have heard of, either Prilosec or Losec. Those are amongst the most common. The side effects of this group of drugs is a risk of bone fractures, vitamin deficiencies, and kidney disease. And this is particularly with the longer term use. However, because of the manner in which or the instance in which these drugs are prescribed, they tend to be used long term. Now, those are the three families of antacids in a nutshell. Crucially, the big takeaway is that none of these three families of drugs treat the cause, okay? And so the symptoms do not resolve. They might resolve in the short term, but they recur because, as we know, when we don't treat the cause, then the symptoms will come back again and again. And so many people stay on these drugs for the rest of their life after symptoms of gastric reflux begin to present. And as we always emphasize in natural medicine, it is of utmost importance to address the cause if true and lasting health is what we're after. And so to do this, what we need to focus on to achieve this true resolution of this phenomenon, this health, this major and pervasive health condition, as I say, is we need to address one's diet. Okay, this is absolutely fundamental. Secondly, we need to address the health of one's liver. Goes hand in hand with this condition, address the health of the bile ducts, and often that may require cleanses of the liver to flush out gallstones. And then thirdly, to address the health of one's gut, very important as well. And this may require cleanses of the gut in this instance. So there is much more detail, however, with respect to truly addressing this condition. And so please reach out to myself if you do struggle with this condition or know of someone who does, or to a natural medicine practitioner who can help you to treat the cause. Honestly, it will be life-changing for you if you do, and if you've struggled with gastric reflux related symptoms, and crucially, when the cause is not addressed, a whole host of disease conditions could await down the line. So take it seriously, address it now before it becomes more serious. So again, it is of utmost importance to address the cause. However, in addition to this and alongside it, there is a wonderful natural recipe using one of nature's medicines to address acid reflux, and which will help you to avoid the use of these drugs and to help you to safely wean yourself off them. and avoid the side effects of those pharmaceutical drugs. And the good news is you can easily make this this recipe in your own home, and so I share this with you now. Now, this recipe makes use of an everyday vegetable, and this is the wonderful and really very unassuming cabbage. And you may ask the question, so why the humble cabbage? Why is this the answer to this really, very, very pervasive health challenge? Well, the cabbage, as you may know, comes from the cruciferous family of vegetables and other veggies in this cruciferous family include broccoli and Brussels sprouts and many others. But the key point here is that cruciferous vegetables contain a natural compound which we refer to as sulforaphane. And sulforaphane is sulfur-containing. It's an amazing antimicrobial and has anti-inflammatory properties, and it is well recognized for being highly effective in inhibiting cancer. So, right there is a great reason to include this wonderful family of vegetables into your diet. But with regards to its application here with helping with acid reflux symptoms, sulforaphane helps to normalize gut microflora and enhances the health of the gut barrier. Really, really crucial in getting good and long-term results with this health phenomenon, health challenge. It also exerts powerful antioxidant effects by virtue of the fact that it induces the synthesis of glutathione. Now, glutathione can be considered the mother of all antioxidants, so that's really significant right there. In addition, cabbage also contains glutamic acid. Now, glutamic acid, while it's a non-essential amino acid, meaning that the body is capable of producing its own glutamic acid, if a deficiency in glutamic acid should arise, it can lead to a compromised gut integrity, a leaky gut syndrome, which we've referred to before, and with that, a poor immune system function of the gut. So it's another reason why the cabbage is so good for the health of our gastrointestinal system. Okay, now getting to this this cabbage recipe, it's a cabbage juice recipe. And first off, I just want to give special credit here to Dr. Janey. He was the original founder of this recipe, and allegedly he together with others, was responsible for giving this cabbage juice to many prisoners in Alcatraz, and every one of them were reportedly healed of long-term stomach ulcers. So, without further ado, let's take a look at this recipe. Now, first of all, take note that a juicer will be required to make this cabbage juice. And I do urge you to use organic ingredients only. Number one, the most important star of the show, of course, is the cabbage. So one small head of green or red cabbage. And then to this, we add 3 carrots, 6 ribs of celery, and about 1 inch of a piece of ginger root, okay? And we just rinse these veggies, we cut them up, and then we place them through the juicer, and voila, we have our juice. Simple as that. And this recipe, those amounts I've just shared, will yield about 1 litre of this cabbage juice. And then what one wants to do is divide that juice into about 5 servings, and so that will be about 200 mils per juice, and to have this at intervals throughout the day, so 5 times a day. And studies have been done on this juice that have demonstrated that many patients felt less symptoms and immediately less pain, particularly those with the stomach ulcers, which can be very painful, after drinking the juice for just 2 to 3 days. In the case of those who had very long-standing symptoms and severe ulcers, you really want to be drinking the juice daily for at least 7 days, up to 21 days. And I would always recommend continuing for ideally at least a week beyond resolution of all symptoms. Now, as always, I recommend that you do this working alongside the guidance of a natural practitioner who can help you address the cause, remember, alongside using this wonderful, simple recipe. And in doing so, not only resolve your symptoms for good, but successfully get you off all these antacids for good. So I hope that's been helpful, and really I just salute you in approaching this condition in a manner that addresses the underlying cause. And so with that, to your great health and to your self-reliance and health, so much love. Until next time.